So my name is Laurie Scudder. I'm a nurse practitioner. I've been a nurse for 40 years, a nurse practitioner for 35 of those 40 years. I'm the director of continuing professional education at the Consortium of Multiple Sclerosis Centers, and I've been with the CMSC for a little over 10 years. CMSC is a professional organization comprised of MS centers and clinicians, and our mission is to improve the lives of persons with MS. So that we do that through education of the healthcare community, as well as supporting research and advocacy efforts. I think it's important to recognize that there are a wide range of key players in the MS team. And those clinicians, who they will be, will vary by patients and by the patient's condition, by their geographic region, by their insurance, by their other resources, including, importantly, family resources and community resources. That range of professionals typically begins with a neurologist who may or may not be an MS specialist neurologist, and then broadens out to nurses, nurse practitioners, physician assistants, pharmacists are key players, rehabilitation professionals, both physical therapists, occupational therapists, speech therapists, and then a wide range of mental health professionals who are key: psychologists, psychiatrists, social workers, and even broader, that team will include the staff within those healthcare settings. So it's really important that a billing office will work with patients to be sure that claims are processed correctly and submitted correctly. Important to help them identify community resources. So that team is going to represent a range of experiences and unique perspectives, and as I said, will vary. But the most important person on the team, quite frankly, is the patient and the family, and that individual is your individual resources within your community. That can be somewhat challenging sometimes to identify. Patient advocacy organizations can be key. They can provide links to support groups, information, online resources, and an important referral network. So the impact of that network of professionals cannot be overstated. The importance of that very broad perspective of a wide range of healthcare professionals and other individuals who have varying backgrounds and previous professional and patient experiences. Clinicians are going to bring their lived experience with them. And so clinicians who have worked with other patients with MS, other persons with MS, are going to be able to bring their knowledge of their previous patients with them. And that's going to be a really important perspective for you as the patient. It's really key that these individuals understand what they don't know, what they know and what they don't know, and when to loop in other professionals, other individuals' experiences, and to recognize that one person cannot do it all, that it truly takes a team to provide all of the care that you are going to need through your journey with MS. And your journey is going to be uniquely your journey and not somebody else's journey. So that you're going to need those individuals at varying points along the way. And the advantage of MS centers, and not everybody can access an MS center. Let's be frank about that. While there are a wide number of them all over the country, depending on where somebody lives, depending on their insurance, depending on their ability to travel to an MS center, they may or may not be able to access those services. But if you have the ability to network an MS center, even if it's an MS center that you're only going to visit once a year, once every couple of years, that can really be helpful to loop you into that big, broad network of professionals. it's important when looking for a healthcare professional that you be sure it's somebody who's going to be flexible enough to meet your needs. MS centers, for example, are going to provide telehealth services, not on an initial visit, but certainly on subsequent visits. And so that's something important to know when you're researching centers is, are they going to be able to provide those kinds of services that if you're in a rural community or your MS precludes you from being able to travel easily, are you going to be able to access that network and that support when you do need it? But it doesn't have to just be an MS center. It's important that you have local healthcare professionals. A primary care clinician is key. Local support groups, local individuals who can treat, for example, a urinary tract infection, a common thing to occur in patients with MS, and you want somebody who's comfortable doing that. A local pharmacist is going to be an important player because that individual is going to have a great deal of knowledge about the disease-modifying therapies you may or may not be on and how they may change as you progress along your journey. There certainly will be challenges in building an MS care team as you progress along your MS journey. But there are a number of strategies to help you do that, because finding the right team is key. There's a concept in pediatrics called the goodness of fit. And the meaning of that concept is that there is no one particular way that a parent can parent. With the exception of the extremes, there's a range of really good parenting styles, and that style, it's important that that style fit an individual child. Well, the same is true for us as adults. The goodness of fit is key. So the clinician that's right for somebody else, even right for a friend or another family member, may not be the right fit for you. Most recommendations for finding a clinician really encourage patients to rely on the advice of family and friends. And that may work well when the clinician you're looking for is a dentist or a primary care clinician, but it doesn't work as well when the person you're looking for is a neurologist with expertise in MS. So that's going to require some more homework. Fortunately, there are a lot of resources out there to help you with that homework. Your own individual healthcare professional community is going to be key. So turning to a primary care clinician, turning to a trusted nurse that turning to your local pharmacist for recommendations certainly is a nice way to start building that MS team. It's also important to kind of do your own homework. If you're able, get online and do some research. Bring in other family members or friends who can help you do that online research. Check that the neurologist you're considering visiting is board certified. See if they have experience in MS. Look at what their educational experience has been. Most of that's available online and oftentimes on that clinician's website. Look to see if they have publications in the area of MS, if they're a member of the consortium of MS centers, if they're up to date on the world of MS, because the world of MS has been changing rapidly and dramatically, especially over the last 10 years. Is that clinician able to accommodate your needs? For example, we already talked earlier about telehealth visits if you live out of an area or if you have physical limitations. A willingness to work with a local clinician. So that MS neurologist may be an hour away from you, but are they willing to talk with your own primary care clinician when that individual has questions about perhaps another medicine that you need to be taking for another reason, whatever that reason may be? You can cold call neurologist practices, and you can tell a whole lot about a practice by the way their office staff responds. If you call a neurologist and they say, "We're sorry, we can't see you for 9 months," and they hang up, well, that tells you something. But if they say, "Our clinicians are really, really busy, but we'll work with you to help get you into our system as soon as we can," recognizing that we have to accommodate the needs of our current patient load. Well, that's a very different message than we can't see you for 9 months and best of luck. Professional resources can also be a huge service, particularly the National MS Society. NationalMSSociety.org has a great website. They have a chat line that you can utilize with an MS navigator who can help put you in touch with resources within your own community, as well as help you to identify patient support groups and other resources. NationalMSSociety.org also has online resources available and just a wealth. It's worth getting on the site and clicking on the resource page and taking a look and seeing what you find. This site, MS Teamworks, has a whole library of information that can be helpful. So the last strategy is, where you can, try and expand your geographic area. If your insurance, if your travel permits it, expand. Look outside of your immediate network, recognizing that you're not going to need to be going to an MS center or a neurology practice, perhaps in a nearby city that's bigger than your local community can provide. You're not going to need to be doing that on a weekly, monthly basis, but maybe as infrequently as once a year. And so it may be, if you're able, that it's worth making those trips. If it's possible, if insurance allows, if your family network allows, if your own travel allows you to do that. So I think all of those combined can be good strategies to help the MS patient, help you identify good resources. The main messages I hope that listeners to this video will take away are that, first of all, trust your gut. You know your own body, you know your own MS journey better than anybody. So if things don't ring true to you, if advice you're hearing doesn't sound right, trust yourself. Get other opinions, do your homework, ask questions. Believe that you are the best resource out there to manage your own journey, and don't give up. Don't accept someone who is merely okay. This is a clinician these are clinicians, many of them, therapists, mental health clinicians, neurologists. These are clinicians you're going to be having a relationship with, hopefully, for a number of years. That you're not going to be changing team, that when you build your team, it's a team that you're going to stick with and they're going to stick with you. And so that means if the first clinician you go to, the first neurologist, the first physical therapist isn't a good match for you, don't be afraid to break up with that person and to do some more research and to identify another person until you find that goodness of fit, that person that's the right person of you. And most key is enlist an advocate. Enlist an advocate. Think about MS navigators. Think about family and friends who can be your advocates, but also utilize professional advocates. Turn to clinicians as your advocates. Family and friends are your family and friends, and that's what you need them to be. But you need advocates that understand MS, that understand the nature of your needs. And family and friends aren't always going to be able to do that. And you need them mostly to be your family and your friends and your emotional support, and not necessarily be out there doing clinical research and asking tough questions and helping you identify the best professional resources out there. I wish you the best of luck. There are a lot of people out there with a lot of expertise to help you along this journey.